Subject today is impression for crown and bridge work. This subject will be divided into three parts. In the first part, we will deal with the impression materials. We will give a quick review on the currently used impression materials in fixed prosthodontics. In the second part, we will deal with the impression techniques. In the third part, we will deal with gingival retraction. An impression is a negative reproduction from which a positive reproduction could be obtained. In fixed prosthodontics, we need to take an impression since it is not possible to fabricate the final restoration directly inside the patient's mouth. Therefore, an impression is required to obtain a cast that will be used by the laboratory technician for the fabrication of the final indirect restoration. Types of dental impression. We have the conventional impression, or so-called analog impression or physical impression, using an impression material loaded in the impression tray. And we have the digital impression using intraoral scanner. Requirements of an ideal impression material. An impression material should be elastic so that it can be removed from the undercut areas without distortion or fracture. Meanwhile, an impression material should have high elastic recovery so that it will regain its original dimensions after removal from the undercut areas. An impression material should have adequate strength to resist breakage or tearing on removal from the patient's mouth, the so-called tear strength. An impression material should have high dimensional stability for a period long enough to permit for the production of a cast. An impression material should have adequate accuracy for the production of the fine details An impression material should be hydrophilic when possible. Hydrophilicity is determined by the contact angle formed between the impression material and a liquid. The lower the contact angle, the better is the wettability, and vice versa. An impression material should be easy to use with the minimum of equipment. And finally, an impression material should be free of toxic or irritating components. Requirements of an ideal impression. An acceptable impression must be an exact record of all aspects of the prepared tooth or teeth. All teeth in the dental arch and soft tissues immediately surrounding the prepared tooth must be reproduced in the impression. This will allow the cast to be accurately articulated and contribute to proper contouring of the planned restoration. The impression must be free of air bubbles, tears, thin spots, and accuracy. Impression materials used in fixed prosthodontics in a historical order are polysulfide, C-silicone or condensation silicone, polyether, A-silicone or addition silicone, or vinyl polysiloxane impression material, and finally the hybrid impression material, vinyl polyether silicone impression material, which is a new generation of impression materials. All impression materials belong to the same category of materials, which is called the elastomers, which are composed of a polymer and fillers. The type of polymer determines the material's properties, while the amount of fillers determines the viscosity or consistency of the impression material. Concerning the viscosity of impression material, we have different viscosities. We have the putty, putty soft, heavy, medium or monophase or regular body, light body or low consistency, and extra light body or wash material. Impression materials could be mixed either manually by hands or by using auto mixing machines that can correctly dispense and mix the impression materials. The first impression material that had been used in crown and bridge work was the polysulfide impression material, which was introduced in the early to mid 1950s and also known as rubber base. This material has faced wide popularity among dentists at that time due to its elasticity. However, polysulfides are no longer used nowadays because of their dimensional instability. Other drawbacks of the material are long setting time in the patient's mouth, which results in poor patient's acceptance, altogether with the unpleasant sulfide odor of the material and the brown discoloration of the clothes if not handled carefully as a result of the lead content. These drawbacks of polysulfide or introduction of condensation silicone impression material. This material has a relatively short setting time in the patient's mouth, typically 6 to 8 minutes, and it is odorless and does not cause permanent discoloration of clothes. However, its dimensional stability is less than that of polysulfide. The chemical composition of condensation silicone: the material is supplied as a base and accelerator or catalyst in different consistencies in the putty, putty soft, and light body consistency. The base is composed of a linear silicone called polydimethylsiloxane and fillers, while the accelerator may be a liquid of stannous octate, suspension, and alkyl silicate, or it may be supplied as a paste by adding a thickening agent. Still have shortcomings or disadvantages. The main disadvantage is the poor wetting characteristics. The material is hydrophobic and the material is dimensionally unstable. This is because of the mode of polymerization of the material that gives off ethyl alcohol as a byproduct, whose evaporation from the set material will result in contraction. Led to the introduction of polyether impression material. This material is unlike those of other elastomers. The material has high dimensional stability since no volatile byproduct is formed. Chemical composition of polyether. The material is also supplied as a two-phase system in three consistencies: light body, medium, and heavy body. The base consists of long-chain polyether copolymer, silica fillers, and compatible plasticizers, while the catalyst consists of an aliphatic cationic initiator, silica fillers, and plasticizers. Advantages of polyether. First, the material has high dimensional stability, as we mentioned earlier. The material is hydrophilic. As we see in this video, the material is injected on the cast in the presence of water. Thixotropic. The material is thixotropic, which means that the material, once subjected to the pressure, the viscosity of the material will decrease, and thus the flowability of the material will increase, so it flows under pressure. Short setting time. However, the polyether impression material has a main disadvantage of stiffness. The set material is stiff, and this may cause problems when separating a cast from the impression made with polyether, especially in thin teeth such as the mandibular incisors that may be subjected to fracture. Second, polyether should be stored dry, otherwise it may undergo imbibition. Addition silicone impression material. This material is the most widely used impression material nowadays in fixed prosthodontics, also called asilicone or vinyl polysiloxane. The main difference between the addition silicone and condensation silicone is that it has much greater dimensional stability, since its polymerization reaction does not give off any byproduct. The material is supplied as a two-phase system in different consistencies. The base consists of dimethyl siloxane with vinyl terminal groups and fillers, while the accelerator contains dimethyl siloxane with vinyl terminal groups, fillers, and platinum catalyst. The advantages of addition silicone: high dimensional stability, high elastic recovery, less rigid than polyether, and the material is hydrophilic. However, the material is intrinsically hydrophobic, but by the addition of surfactants, the hydrophilicity of the material has been improved. Another advantage of addition silicone impression material is that impressions could be poured several times if needed. Disadvantages of addition silicone: as we said, the material is still intrinsically hydrophobic, although surfactants are added. Setting inhibition by some brands of latex gloves, and setting inhibition by uncured and partially cured adhesive layer when this material is used to take impression for indirect restorations and IDS immediate dentin sealing has been done. The last material is the vinyl polyether siloxane, or vinyl polyether silicone. This material is a combination of polyether and addition silicone. So this material combines the positive characteristics of both materials in one material. So the material becomes intrinsically hydrophilic without the need for surfactants. The material has high tear strength, and the material could be predictably used for subgingival, has predictable flow subgingivally with a minimum of voids and bubbles.